Okay, and now we're going to talk about drug abuse or substance abuse and various brain regions, neurotransmitters involved, as well as some of the aspects of positive and negative reinforcement. Nearly every drug that we talk about that has a psychological effect on us acts at the synapses. And most of the commonly abused drugs derive from various plants. And your author, a lot of authors start out this discussion by talking about why. Why are we affected by the chemicals in plants in this way? Well, plants want to attract certain animals and they want to repel certain animals so that they have these chemicals in them and they end up influencing different animals in different ways, including humans. Your author starts the discussion of substance abuse, as most authors do, with this just background in how these drug mechanisms work. And so we have actually discussed agonists versus antagonists before, way back when we talked about neurotransmitters in general. I just kind of threw in these terms so you would have some exposure, but here they are again. If I am a drug and I am an agonist for a particular neurotransmitter, I am mimicking the effect of the neurotransmitter or increasing its effect, facilitating its effect somehow. And keep in mind, the neurotransmitters can be excitatory or inhibitory. I'm an agonist for the neurotransmitter. Versus if I'm an antagonist for a neurotransmitter, I am somehow blocking the effect of that neurotransmitter. Whether that can happen in a myriad of ways that I'm not going to go into all the different ways. For Cal, it doesn't, and it's very time consuming. But just as examples, I can get in and block a receptor. I can stop the production. I can somehow make it so there's less of the precursors, so there's less of the enzymes that help with the production. All of those different ways of being an antagonist. I'm blocking the neurotransmitter, where again, remember, neurotransmitters can be excitatory or inhibitory. So I think it's confusing sometimes that it's not clear what the effect is going to be, because if I'm an agonist, I could still be excitatory or inhibitory. I'm increasing the effect of the neurotransmitter. If I'm an antagonist, I'm blocking the effect of the neurotransmitter. And some drugs are agonists for one neurotransmitter and antagonists for another neurotransmitter, so they have these mixed effects. Another couple of terms that are really important to understand how drugs work is affinity and efficacy. So my affinity for a particular receptor is how likely am I to fit into that receptor. It can be particularly high, where I'm likely to fit into a particular receptor site or a receptor that recognizes a particular neurotransmitter. It can be very low. It can be in between. And I have the efficacy. So am I influencing the postsynaptic neuron in the same way that the neurotransmitter would? I can have high efficacy where I am fitting into the receptor site and I am influencing that postsynaptic neuron, or I can have low efficacy where I'm fitting into the receptor site and I'm not affecting the postsynaptic neuron. So if I'm high affinity, low efficacy, I'm fitting into the receptor site very well, and I'm actually not having an effect on the postsynaptic neuron, meaning that I am an antagonist for a particular neurotransmitter. So those play out in several different ways as well. So regardless of which direction all of this goes in, it's nice to always repeat this idea of positive reinforcement. And so now we've just talked about learning and memory not that long ago, and positive reinforcement. And I'm going to go through some official definition here, and then we're going to start seeing the role of positive reinforcement in addiction and substance abuse. Positive reinforcement is the occurrence of an appetitive stimulus, increasing the likelihood of the most recent response in the present situation. If we look at an example, rats learn that they will receive food, so the appetitive stimulus is food, in response to pressing a lever. That's the response, the recent response that I want to see an increase in the chamber that contains the lever. So that's the present situation. And that is usually how this occurs, that we're in a particular situation, we make a specific response and we get our positive reinforcement, and that increases the likelihood of that specific response, in this case pressing a lever or taking a drug. The appetitive stimulus activates a reinforcement mechanism in the brain. And that's not the whole answer of how we get addicted to drugs, but that is a piece of the answer. It influences our addiction to drugs. So if we look at the neural mechanisms of positive reinforcement, we see that abused drugs share certain effects on dopamine and norepinephrine, and particularly that dopaminergic pathway, reward pathway that I have now talked about several times. And now I'm going to talk about how we discovered this reward pathway. It was discovered by James Olds and Peter Milner, who were stimulating certain brain areas in a rat. And they were trying to make the rat turn in a particular direction based on stimulating this brain region. But they started off by hitting an area called the septum, and they found that the rat, when stimulated, would sit up and look around and sniff as if reacting to a favorable stimulus. So this was not influencing what they expected. This was a serendipitous result, and it looked like the rat was experiencing pleasure. Here's a picture of a rat pressing a lever for self-stimulation of the brain, and a lot of times this was the septum. They tried several other regions around that, but with the septum, what they found was rats would sometimes press a lever as often as 2,000 times per hour so that they could stimulate those areas that were part of or going into this projecting into this dopaminergic pathway. And in fact, rats would prefer the self-stimulation of the brain to sex, to food, to pretty much anything. And they're doing this 2,000 times per hour. It was very addictive for the rats. In all of the areas that the rats would work to stimulate, they all had axons that directly or indirectly increased the release of dopamine and norepinephrine in the nucleus accumbens. So that is that mesolimbic dopaminergic pathway that we have now discussed a number of times. And I'm going to get back to that ventral tegmental area where we're producing the dopamine going into this mesolimbocortical, as we talked about last time, into that system. So I've already talked now about the ventral tegmental area and the nucleus accumbens as part of that, as that mesolimbic system, and the ventral tegmental area is producing the dopamine that is going to go up through the mesolimbocortical system. But this mesolimbic system is what's important for the neural mechanisms of positive reinforcement. And a single administration of a variety of drugs increases the strength of excitatory synapses on neurons in this area, because with the administration of various drugs, we see the insertion of additional AMPA receptors, so those glutamate receptors that allow the neuron to let in enough sodium so that we can see changes in the brain, so that we can stimulate and excite the NMDA receptors. And so usually, this is all mediated by NMDA receptors as the neural basis for learning, and we're going to see this as we are being positively reinforced. This area is also going to start to communicate up to that mesostriatal area, because we're learning new habits, and especially when we are reinforced for those habits. And I did take some of this from Neil Carlson, who actually wrote probably my favorite textbook so far on brain and behavior and physiological psychology. I don't use it because he talks a bit over people's heads, but this, you can see the rat brain in this case, and so things look a slightly bit different, but that's because we're looking at a rat brain instead of a human brain. But same idea with the human brain. So we see the administration of most of our drugs are going to have, we're going to see an increase in excitatory synapses in that ventral tegmental area, and those are going to project then to the nucleus accumbens, that's basically our mesolimbic system, and neurons in the ventral nucleus accumbens, now abbreviated as NAC, and the ventral tegmental area as VTA. They project back to the VTA, which then send the dopaminergic projections back up, and then that go back to the dorsal area of the nucleus accumbens, and we go back and forth until we get more and more dorsal into regions of the striatum, all the way up to the caudate nucleus and the putamen. And so what we're seeing is, originally, that is a dopaminergic reward pathway, and we're seeing pleasurable effects, but eventually those behaviors become habitual as the basal ganglia take over a lot of our habitual aspects of our movement and are very influenced by the vigorousness, as I've been saying here and there all along, how vigorous our responses are, these habits are, depend on reinforcement. If we look at the role of the prefrontal cortex in all of this, the prefrontal cortex, remember, is involved in judgment, in considering various aspects of a situation when we're making good judgments, considering things like the future and other people and all of that. It is also involved in risk-taking and control of inappropriate behaviors. So in helping us, if we have a strong prefrontal cortex, we tend to take fewer risks, and we also are better at controlling our impulsive behaviors or things that might be inappropriate. And so we see some regions of the prefrontal cortex have inhibitory connections back with the striatum. And actually, when we are inhibiting our impulses, we are strengthening those connections. And we don't have to do this in relation to drug addiction to strengthen those connections. But we have profound maturation of the prefrontal cortex during adolescence. If you remember us talking about that before, of part of the development during adolescence. And approximately 50% of cases of addiction begin between the ages of 15 to 18. So we see for people who are likely to abuse substances, this is starting before the prefrontal cortex is finished with its maturation processes. And in fact, so 10 to 12-year-old boys who scored low on tests of behavioral inhibition had increased risk for developing substance abuse disorders by the age of 19. So I'm gonna do something that sounds like I am giving an excuse to people who have substance abuse problems or who are addicted. But honestly, I think that what I'm trying to do is show that it's important to show a lot of compassion for people who have substance abuse issues, because, again, 50% of the cases begin early. And when we look at the kids, the really young kids who are scoring lower on tests of behavioral inhibition, they're the ones with the most risk. We've talked about the importance of the dopaminergic reward system on becoming addicted, but your author makes it really clear that that's not the whole answer, and in fact, we can mitigate the effects of that dopamine system, and we still see people becoming addicted to drugs. So other neurotransmitters, or in this case neurochemicals, peptides that are influencing the likelihood of becoming addicted or having some kind of substance abuse. One is orexin, which we talked about when we talked about wake-sleep cycles. This helps control our sleep stages. It also influences our food-seeking behavior. So we release orexin when we are very hungry, and it's released from the lateral hypothalamus and into the ventral tegmental area, the nucleus accumbens, and the dorsal striatum. Another peptide that's important is melanin concentrating hormone, or MCH, which stimulates hunger and reduces metabolic rate. This is also released from the lateral hypothalamus and released into the nucleus accumbens. So both of these peptides are important for when we become addicted to drugs and for controlling drug abuse. Another thing that plays a role is negative reinforcement. We go back to our learning and memory. What is negative reinforcement? It's the taking away of an aversive stimulus that increases the likelihood of the most recent response in the present situation. So, example, rats learn that they will stop receiving a shock, so the shock is the aversive stimulus, in response to pressing a lever, the recent response, in the chamber that contains the lever, which is the present situation. So what they learn is, in this particular chamber, I'm going to press a lever to stop the aversive stimulus of being shocked. And negative reinforcement plays potentially a more powerful role in many ways than positive reinforcement, especially once we become addicted. To understand the role of negative reinforcement in drug abuse, it's important to understand tolerance and withdrawal. So with tolerance, as we're taking a drug over more and more time, more and more times, we are decreasing the enjoyable effects that we can get from those drugs, or really the effect that the drug is having on the body. And this is occurring because of compensatory mechanisms within the body itself. So you can think of this as classical conditioning of I'm in the same room, or I have the same triggers and the same things around, and my body already starts its compensatory mechanisms to where that drug isn't going to influence me as much as it used to, or as it would if I were in a different situation altogether. This is actually how we see those heroin overdoses, is that over time the heroin user needs to use more and more of the drug in order to get those enjoyable effects. They're usually doing that in their regular kind of haunts and hideouts, but then they go to someplace new and those same compensatory mechanisms don't kick in, and they take the same amount that they used to take, and that's enough to kill a person. And so now they've done that damage. We also see withdrawal. So as we're decreasing the enjoyable effects, we're also increasing the really unenjoyable, really painful effects of when I'm coming off of that drug. And eventually, the reduction of those withdrawal symptoms play a role in maintaining someone's drug addiction, which is what I was explaining before. That if this is an aversive stimulus, the withdrawal symptoms, and then I take a drug, I'm being negatively reinforced because it's taking away that aversive stimulus. And so using a drug when we are in the process of withdrawal, when our body is withdrawing, that is actually very reinforcing for taking that drug. And the compensatory mechanisms that we see for tolerance are really responsible for the withdrawal symptoms as well. Taking a drug over an extended period of time produces long-lasting changes in the brain that increase a person's likelihood of relapsing. There are many triggers, and when they see or smell or feel those triggers, they crave that drug again, even after a long time of not having the drug. So I couldn't find the slide but I have one somewhere of a person who no longer takes cocaine but was addicted once, and they're watching people take cocaine in a film, and you can see the anterior cingulate gyrus just on fire as they are really wanting that and trying to talk themselves out of that craving. Is what I assume the anterior is the anthropomorphizing of the anterior cingulate gyrus in my example there. Your author talks about this with cigarette smokers who smell somebody smoking, or cocaine users who see any of the triggers for using cocaine. But this example is an excellent example. This is an example of the reinstatement procedure that is done on rats. So one thing it shows is that when we learn extinction, this is a learned response. It is new learning, and it is not a forgetting of the previous learned response. And so in this study, they trained rats to lever press in order to self-administer cocaine. And you can see in those first 10 days or so, they are learning very well. They're lever pressing quite a bit in order to get that cocaine. And then over the next 14 days or so, they have the lever in the same crate as before, but there's no administration of cocaine. If I remember correctly, it is some saline solution, so they are lever pressing for saline, and we see a real extinction of the response, okay, that they're not pressing the lever anymore. And then on the 15th day, they give them either some cue that they were getting in the first 10 days, but or some cocaine. And then the rat immediately starts lever pressing again. So that last pop up there is there 150 times that day. They start lever pressing really fast, thinking they can self-administer that cocaine again. And of course, it's still a learned response that they have not forgotten, and it's still in the wiring, basically.